Mano a Mano Bolivia is a non-profit, non-governmental organization that was founded in 1996 with the mission to promote local sustainable development and community participation in Bolivia with limited financial resources through comprehensive social infrastructure projects in health, education, roads, and more. With our organizational model, we strive for empowerment and local participation in the community's own development. We require municipal and community partnership that complements the funds raised by Mano a Mano Bolivia from people and other organizations. Under this partnership model, we have completed 136 health infrastructure projects up through the month of November 2012.
Our gynecologist office and the dental office.
Aplausos, por favor. Queda inaugurado.
Many of Bolivia's communities have a low Human Development Index score, which limits their resources to develop new and adequate infrastructure. As a result, this hampers the implementation of Bolivian health policies and programs in these communities. It decreases access to health services. It impedes the basic capacity of birthing attention and patient hospitalization, and it limits the possibility of employing more health personnel. All of this results in negative indicators of health, particularly in mothers and children. Since 2010, Mano a Mano Bolivia has received requests from the municipality of Tomave for the construction of a new primary healthcare center and all the necessary equipment in the community of San Francisco de Tarana. San Francisco de Tarana is a rural community under the jurisdiction of the municipality of Tomave in the department of Potosi in the province of Antonio Quijano, about 90 kilometers from the city of Potosi. Its population of more than 900 people is characterized by having limited financial resources as they are largely engaged in subsistence farming and raising sheep and llamas. This is their primary source of income. San Francisco de Tarana is located 10 hours from the city of Cochabamba on an asphalt road that ends in 16 kilometers of temporary makeshift road that disappears during the rainy season. Llamas and sheep graze abundantly alongside their caretakers on this road. The next health center is 40 kilometers away, and the nearest hospital with surgical capacity is in the city of Potosi, which is 160 kilometers away. The current center was built by the people of the community, but it has an ancient structure, built of adobe with only 4 rooms in poor condition. One of the rooms functions as an exam room, a delivery room, and an emergency room. Another room served as a makeshift hospital room with beds. The only healthcare provider that works there is a nurse. There is no water in the health center, and the closest bathrooms for both the staff and the patients are public bathrooms outside, 40 meters away from the building. In case of emergencies, an ambulance can come from the Tacora Health Center, which is 40 kilometers away. Other transportation options are trucks and animals that travel the road on a weekly basis. They communicate via shortwave radio to transport patients. In these poor conditions, there are still more than 150 visits per month, not including immunizations. This current infrastructure hampers the implementation of health programs under the direction of the Bolivian government. It limits the performance of existing health personnel by offering only outpatient procedures. It hampers the delivery of immunizations because people can only visit the center occasionally. It forces more births and emergencies to be attended to in the home, which in turn increases risk for complications. It diminishes job satisfaction in healthcare, and it has decreased the capacity to employ other healthcare providers. To improve this situation, Mano a Mano is searching for the financial counterpart to complement the resources of the community and the municipality. The total cost of the entire project of building a new health center is $55,000 and is nearly half the commercial cost for these types of infrastructure projects. The municipality of Tomave will participate by contributing 53% of the total cost, including construction materials and equipment. The community of San Francisco de Tarana contributed 2% of the total cost. In addition, they will participate by sending volunteer workers to support the project. We need to obtain the remaining 45% through contributions and donations to cover the total cost of the project. The new health center will have an exam room, a nurse's room, a dentist's office, a delivery room, a hospital room, an auxiliary room, a waiting room, a small kitchen, 2 bedrooms for the healthcare providers, and 2 bathrooms. The objective is to construct and fully equip a new primary care health center in the community of San Francisco de Tarana in under 4 months. With this, we hope to provide an adequate environment for the proper delivery of health services and preventive medicine, implement and expand health and immunization programs as mandated by the Bolivian government, improve the capacity to resolve illnesses, increase the number of health center visits, provide support and technical knowledge regularly to health providers with continuing education, increase the number of healthcare providers, improve poor indicators of health, and empower the population to improve their own health. Only with your participation, they communicate via shortwave radio to transport patients.